Okay, so I hope you can all see the presentation. Bridget, you are in my line of view, so can you nod if you can see my screen? Awesome, thank you so much. Okay, so thank you again for coming and listening to our presentation today, our webinar about Northeastern University's co-op for the PharmD program. Majority of this webinar is going to be presented by our current students who are School of Pharmacy ambassadors, but I just wanted to give a very brief, warm welcome and introduction. So we'll start off with that. So my name's Christina Folsom. I'm the admissions coordinator for the PharmD program. So I work in the School of Pharmacy under the Office of the Dean. If you have any questions about the PharmD admissions process, I am your person. I really enjoy interacting with applicants, and I'm an office of, at the moment, office of one. So if you apply to our program, we are going to have a lot of different communication throughout the various stages, and that's the best part of my job. So please feel free to reach out at pharmdadmissions@northeastern.edu. I have special time dedicated each week every Thursday from 9 a.m. to noon Eastern Standard Time, which is a chat with the admissions coordinator sessions. They're half-hour long and you can sign up for them. And basically we go over your transcript, any questions you might have about the admissions process. Happy to help and happy to give feedback in advance of submitting your application or even after you've submitted if you have questions about the program. So please feel free to reach out at pharmdadmissions@northeastern.edu and I'm happy to set up a time to chat. So we're just going to start off with a very brief overview of what co-op at Northeastern is like. So co-op is a paid full-time 4 or 6 month internship that students at Northeastern complete to fulfill their major requirements. Direct entry PharmD students perform 2 4-month co-ops. One is institutional, which is traditionally a hospital, and one is in a community, which is traditionally outpatient pharmacy, to fulfill their major Epi hour requirements. So across the United States and in some schools in Canada, you are required to do a certain amount of Epi and API rotations before receiving your PharmD degree. What's great about co-op is that in lieu of grades or credits towards your degree, you actually get paid. So it's the only paid co-op program for a PharmD program in the United States. And it goes towards your mandatory intern hours. And it really is like a real job, which many of our students are going to be able to share with you today. You are an employee and you're definitely held to a different standard, but in a good way, and to maintain professionalism, to learn more about the profession. So how it works, again, our ambassadors today are going to go over their personal experiences, but for the direct entry, for the graduate pathway, in the spring of your P1 year and the fall of your P2 year, you'll submit applications, which are resumes and references, to different sites around Boston. And you'll have the opportunity to interview at those sites and they will contact you directly to set up those interviews. A great thing about our program is we have 2 full-time dedicated co-op advisors who are both registered pharmacists. Both have actually been working at Northeastern for 20 plus years. I won't date them by giving the exact number of years, but it's been a long time. And so they have a lot of experience with this and building up relationships, which is great for our students. Upon hiring, you will perform basic orientation and onboarding-like procedures, and you'll have a designated preceptor who will monitor your progress and fill out forms that are then sent back to the university. So non-international students may have the option to stay on per diem. And many of our students take advantage of this and work part-time after their co-ops are over with the co-op location that they enjoyed. And so that's a great opportunity as well to earn some income. So this is the last point. There is a great segue to just mention that if we have international students here today joining our webinar, yes, we don't have any international student ambassadors here today to talk about their experiences, but international students do perform the same co-ops that our domestic students do. The one exception to that is CVS. CVS doesn't hire international students, but that's only one of 200 preceptors and locations that we work with throughout the greater Boston and actually throughout the United States. So international students do have the opportunity to go on the same level of co-ops as our domestic students. If you're an international student, you have questions specifically about co-op or about applying to our PharmD program, please do reach out. I have a lot of background knowledge in that. So that was my brief overview to kind of give you an introduction and hopefully welcome you from the official school perspective. Now we are going to turn it over to our current students, and they are going to tell you a little bit about themselves and tell you about their co-ops. And for those students who are here today, as your name pops up, like we did on the housing webinar, you can go ahead and unmute yourself and introduce yourself, and there's 2 slides for each ambassador that's here today. So we'll start out with Adessa.
Hi, everybody. My name is Adessa, and I'm a P4 pharmacy student. I'm originally from Salem, Massachusetts, but I was born in Boston, Massachusetts. So for my co-ops, since I'm an early assurance student, I did 3 co-ops. So the first one I did was at CVS, and that was for my community co-op. And then my second one was at Tufts Medical Center, and that one was for my institution, and then Spalding Rehab was for my elective co-op. And so, in a nutshell, essentially we are given some technician work. So that means for the institutional co-ops, I would be doing like stocking the floors with medications. I'd be retrieving expired medications and bringing them back to the pharmacy to be disposed of. I would be retrieving medications from the medication carousel, and then I'd be giving those to the pharmacist for the final check. And then in addition to that, there are many opportunities for you to be able to shadow different pharmacists. So when I was at Tufts Medical Center, I was able to shadow various pharmacy roles. So that included neuro ICU, transplant, investigational drugs, and then also the cardiac transplant pharmacist.
That's great. Thank you, Adessa. We will have opportunity to ask specific questions at the end. So we will move on to Melissa.
Hi, everyone. My name is Melissa. I'm a P4 student at Northeastern. I'm from Carver, Massachusetts, currently living in Boston. My 2 co-ops, I did my first co-op in the community pharmacy, which is outpatient at Boston Medical Center. And then I liked it so much that I went back and did my institutional there as well. I stayed on and work part-time there currently as a pediatric pharmacy intern. And through this experience, I've had the opportunity to learn a lot about compounding of pediatric and neonatal dosing. And similar to Adessa, as she spoke about her experience at Tufts, when you're a co-op student at BMC in the inpatient side, you have the opportunity to shadow pharmacists in your area of interest. And so I shadowed in the emergency department as well as the outpatient endocrinology clinic.
Great. Thank you very much, Melissa. Raya.
Hi, so my name is Ria. I'm originally from San Francisco, currently living in Boston. I am a P2 direct entry student, so I got to do 2 co-ops. I'm currently on my second one, actually. So my first co-op I did at Brigham and Women's Hospital in their inpatient pharmacy. So I got to check all the medications so before they went to the floors, and that kind of gave me a look into dosing regimens and like seeing different medications. My first co-op actually coincided with COVID hitting Boston hard, which was in the spring of last year or this year. And so I got to see all the different medications that they would send up to the floors to all the patients. And for my current co-op, I am at MGH outpatient or Mass General Hospital. So I do a lot of different work there. I work the register. I do a lot of data entry, filling, and answering phone calls, which has been kind of crazy. But I recently actually did my first shadowing opportunity at MGH. I got to shadow in the surgical ICU, and I'm going to be shadowing in a couple weeks at the transplant ICU.
That's great. Thank you. The transplant ICU sounds very interesting. Okay, we'll move on to Bridgette.
Hi everyone, my name is Bridgette. I'm a direct entry P4 student. I'm originally from Warwick, New York, and I'm currently on my Epi Rotations. As for my co-ops, because I was a direct entry student, I was able to do 2. So my initial co-op was at inpatient, and that was at the VA hospital. This one was in West Roxbury. So for this experience, I was able to actually be trained and certified to make IVs. Majority of my time was spent in central pharmacy just because of how the VA is structured, but I did have opportunities to shadow pharmacists both in the medical ICU and then on the floors as well. As for my outpatient experience, it was at Harvard Vanguard, which has several locations throughout the city. I was majorly based in Kenmore, but was able to work at other locations depending on the needs. So that was cool to see different patient populations. And there I was also trained in non-sterile compounding. And beyond that, I still work at the VA Center. It's been really a great experience. You'll notice with your co-ops that there's a lot of opportunity to stay on and continue employment and really build those relationships within the pharmacy field.
Great, thank you very much. And we will move on to, there we go, Caroline.
That's me. All right, hi everybody. My name's Caroline. I came into Northeastern as an early assurance student. I'm currently a P4 on my Epi rotation. I'm right now on an Epi at CHA, so I just crossed the river, although it is virtual, so I'm in an Epi in my room. And I'm from New Jersey. So being an early assurance student, I had the ability to do 3 co-ops, but I picked 2 of my favorites, or well, you can see some of my 3 co-ops were at the Brigham and Women's Anticoagulation Clinic, Inman Pharmacy, and Cape Cod Hospital. My 2 favorites were the Anticoag Clinic. This was my elective rotation, so it is an ambulatory care setting, and it's really great because it is one of the only co-ops that actually give you experience into the ambulatory care setting of pharmacy, aside from just the community or the hospital setting. We did a lot of patient education and interaction over the phone. Mostly we counseled and worked with patients who are taking warfarin, but we also have patients on DOACs and some of the newer anticoagulants. And it's really great at that clinic because it gives you the opportunity for learning all about all the aspects of anticoagulation and cardiology. So you really, really focus in on those topics and learn a couple drugs really well. And if that is something that interests you, I would highly recommend it. The people are great. I've continued working on after, as people will commonly mention, they keep students on per diem. So I continue to work there and I really enjoy it. And for my outpatient experience, I actually worked at Inman Pharmacy. This is an independent community pharmacy over in Cambridge. And one of the reasons I really enjoyed this co-op was because it was different than the typical CVS or Walgreens experience. So since it wasn't a chain, it's a small family-run independent community pharmacy. And you get to see both the pros and the cons to that aspect of community pharmacy. So it differs from just your standard retail setting. The people there are amazing. They like to have students stay on as well. So again, the opportunity for per diem work as you progress through school. And it really opened my eyes to how great community pharmacy can be when you get a chance to talk to patients and don't have some of those negatives that people can reflect when they think about retail in a chain setting sometimes.
Great, thank you, Caroline. Ashley.
Hi everyone, my name is Ashley. I'm from California and I'm actually back home right now because my rotations so far have been virtual. It's been a little difficult with the 3-hour time difference, but it's nice to eat home cooked food. So as for my co-ops, my first one was at MGH Yawkey, and then and that's where I got to practice sterile compounding to prepare chemotherapy. And for my second one, it was actually an international co-op in Taiwan. And you can kind of see a theme of oncology here, but my Chinese is pretty broken. So that was a pretty big learning curve, but I thought it was a really good opportunity to learn how pharmacy operates in a different country. And as for my last co-op, I came back to California to work at an independent pharmacy that I actually previously shadowed at in high school. And something different with this pharmacy is that we did blister packaging for nursing homes, and we also sold like medical equipment in the front. So similar to what Caroline was kind of saying, like kind of a different experience from like the typical chains you think of. And I really like the tight-knit community of the independent pharmacy.
That is great. Thank you, Ashley. Got a lot of experience in a lot of different places there, which is wonderful. So that was meant to be a very brief introduction of the students that we have here today. And I'd hoped that the question and answer session would be very robust. So if you would like to, I'm going to stop sharing my screen. And if you would like to unmute yourself and ask a question, you are welcome to do so to any of the ambassadors we have here today. Or if you would like to type into the chat a question, I'm happy to read it out loud, and we can go round table if it's applicable to more than one of our ambassadors that we have here today.
I'll go. So other than the obvious awesome benefit of getting paid for the co-ops, and this might not even, the students who may not know this, but like what benefits, were there any benefits to doing the co-op at Northeastern versus the other experiential learning activities at other schools that you applied to even?
Well, one thing I can speak to, Northeastern, since the co-op program is so integrated, correct me if I'm wrong, Christina, but I believe that Northeastern is the only pharmacy school that has a specific co-op program at their larger university as well, right?
Yeah, we're the only U.S. school of pharmacy that has a co-op program. There is one in Canada that does, but
I didn't know that. Yeah. So with that being said, the Northeastern University as a whole has a lot of faculty and a lot of resources set up specifically for helping students find co-ops, and kind of everything is kind of focused on the co-op program, if you will. Whereas at other schools, even though you still have the opportunity and you're supposed to do these IPPs and get this experience, it's not something that is as ingrained within the school, because it's a little bit more for the students to do on their own. I obviously can't speak to specifically what other schools have and don't have, but I just have some friends who've gone to other schools that have not had the breadth and depth of experience that we've been able to, since it's so ingrained in Northeastern's curriculum and as a university as a whole. You know, they have, as Christina mentioned, 2 of our faculty members are focused on helping you get your co-ops. And aside from that, it's kind of those other aspects of working. So, you know, they help you make a CV, help you make a resume, kind of those other tips that go along with getting a co-op and getting experience in the field. And it's just a very easy process, because a lot of things in school can be challenging and can be uncertain. And I'm sure it's compounded immensely right now during COVID. So one thing was really nice was it's so built into the curriculum and very much like, okay, this is what you do, here's where you apply. It's all very regimented and very out in the open and very transparent. So it's really easy to do, instead of it may perhaps be harder to do at other universities because it's not something that is as ingrained in the program.
I think also just to add, just like the location Northeastern, there's just so many hospitals and like sites like available around here. Yeah, there's just so many options. Like when you get the list of co-ops, like there's so many to pick from. Yeah.
can also add on to that. I think a really important part about Northeastern's CoOp program is you're working there for 4 months. So you're really building these relationships with the pharmacists. And I'm sure you guys will hear soon, but pharmacy is a very small world. And I was actually able to stay on at my co-op. So I'm coming up on 3 years working there, and I'm currently applying for some postgraduate training. So I'm able to really have those pharmacists speak to my strengths moving forward. So you really build those relationships within the field. And I think that's, you know, hugely important moving forward and deciding on a program for you guys.
I agree with Bridget. I've also been at my part-time position for almost 3 years now, and the relationships that you build with your preceptor, they really turn into your mentors. If you like show an interest in like their field, or if you just have questions, they're always willing to teach and willing to help. And so similarly, applying to postgraduate training now, I reach out to my preceptors from my 2 co-ops very often, asking for like guidance or advice and seeing what their experience was like. And they're just they want you to succeed as a student because they have worked with you full-time for 4 straight months. And so they know you as a person.
And just to add on to that, not all pharmacy schools do IPs for 4 months. There are some schools where they only do it for, I think, like 2 weeks. I think that's like the minimum like IPI requirement for accreditation purposes. So having that 4 months allows you to gain like an even wider experience working in pharmacies. So.
I have a quick question. So I'm from Chicago and I go to school at Brandeis out in Massachusetts. And I know some people mentioned that they did co-op programs outside of Massachusetts. So I was just wondering if anyone could speak to doing a co-op in Boston and Massachusetts versus either in their home state or another place.
I'm not sure if anyone else on the call has gone outside Boston, but the one I didn't talk about, I worked at Cape Cod Hospital, so just a bit outside Boston. It was on the Cape, so not very far, but still outside of Boston. It was one of the experiences that is an established co-op through the co-op site that they used to help us pick. You do have the ability to set up your own co-op. Oftentimes that's with, like, oftentimes students do a community, they'll do at like a CVS or a Walgreens in their hometown. I think that's most often done. That for co-ops. I'm not sure how this may or may not be changing with COVID. I don't know if that has any implications on things. But at least for the Cape Cod Hospital one, it was nice because they provided a house for the students. That's very unique to that co-op, but it was awesome because we got to live right next to the hospital and work out there for 4 months, and it was a blast.
Abigail, I can kind of answer your question about maybe like setting up a co-op if it's, so I set up the co-op for the one I did internationally in Taiwan and also the independent in back home in California. And for co-ops, it's actually a very easy process. I think rotations, the rotations that you do last year, that's a little more of a difficult process. But co-ops, as long as you have someone at that site who's willing to be your preceptor, it's a pretty easy process. And the 2 advisors who help you out, I don't see a problem with it. I don't know how to say it, but yeah, I encourage to do it. Especially, I think if you can, like going international, it was like a really, really good experience for me. Yeah. No problem. I hope I answered it.
Okay, who else has questions? I'm actually on the Cape right now, so it's not really that far away from Boston. But from a student perspective, anytime you have to get in a car and drive somewhere, it's far. And I would also say that our alumni network is amazing. While the School of Pharmacy hasn't been, has only been under Northeastern since I want to say the 80s, we are a continuum of the New England College of Pharmacy, which was founded in the 40s. So we do have a very long history of graduating BS in pharmacy, which was the previous degree, and PharmSci graduates, and that alumni network is great for building up preceptor options. And California, New York, New Jersey, so near the city, and all across New England are kind of like our big 3 areas where we have a lot of alumni, and so the network definitely carries over into co-op opportunities as well. Any other questions we can answer?
I have a super quick logistical question, if that's all right. So I was wondering if do you pay tuition for the semester or terms that you are on co-op?
No.
Okay, cool.
But if you want to use the gym, you do have to pay a fee.
That's only if you are a direct entry student, I think.
Oh, okay.
At least I know. I don't know. Maybe I'm.
Caroline. Yeah, it is only for direct entry.
Okay, yeah. I was gonna say.
I think everyone on this call though is direct entry.
Sorry.
Oh, okay. Sorry about that. So yes, you have to pay. Sorry.
Yeah, it's the graduate fees. So if you are not on campus paying tuition, you do have to pay like the fees to use the facilities like the gym. But it really isn't that much, because I know I pay the graduate student gym fees, and it's really not. It's not terribly that.
It's
that
not
much.
bad. Just something to keep in mind.
Yeah.
I have a quick question. So since there are so many different options for you to choose in co-op, so what are some factors that you are looking into in choosing your own co-op? Like, do you choose or something new that you never touched before, or do you choose like something you're really interested in?
So when I was looking at co-ops, I kind of looked at the hospital sizes. So if you're someone that wants like to work in a bigger hospital with a lot of different departments and a lot of things going on, you might want to work at a bigger hospital. Or like if you want to have more connection with like the people that you're working with or the community that you're working with, you'll look for something smaller. I ended up working at Brigham, and I didn't realize how big of a hospital it is, but then it's not as big as MGH, which I realize now when I like started my co-op at MGH and how busy it is and how much there's always stuff going on. So it's kind of like it's up to you on what you kind of are interested in, and as far as like if you're someone that likes to work in a fast-paced environment, you might want to go for something bigger. But if you want something where you're spending more time on like smaller things, then you'll go for something smaller. I don't know if that made sense or if you want more clarification.
Yeah, that makes sense. Thank you.
Also, something to add about that, you have a lot of options in Boston, and I think location could also be a factor. I decided to go outside of the city, but you also have to take into account how you're willing to commute somewhere, and then really the connections that you feel at that place. Even when you're interviewing, you can kind of figure that out as well.
So I have a quick question. How do you all feel like your co-op experience has kind of like shaped your outlook on your postgraduate plans?
Yes. I can just speak for me personally. My final co-op was at the anticoagulation clinic, and it helped me figure out what I think I want to do since I stayed on there. And I'm currently pursuing postgraduate training in the areas of cardiology and ambulatory care, which are the setting of that clinic. So having that experience definitely helped me shape what I want to do.
Yeah, similarly to Caroline, so my institutional co-op, at BMC, I was a pediatric technician, and so having the opportunity to work with the pediatric pharmacists and compound for pediatric doses has encouraged me to learn more about peds, and I'm currently pursuing a residency in pediatrics.
I think for me, it kind of overwhelmed me a little bit because there are so many like options that are so many careers that pharmacists can go into. I originally, after I shadowed the transplant pharmacist at Tufts, I wanted to do transplant, but now I'm thinking infectious diseases or maybe even like hematology or like being a cancer pharmacist. So I'm still kind of like undecided right now, but yeah, there's so many options that you can go into. So co-op allows you to explore many of those areas.
I think I can speak actually to the opposite experience that Caroline and Melissa both had. So my co-ops, although they were a great experience, they kind of helped me figure out what I don't want to do in life, which is also just as valuable as figuring out what you do want to do in life. So I think that for my experience, I valued both of them greatly and the relationships I made with people, but I also realized that maybe this is something I don't want to pursue long term. And that kind of helped me figure out my plans for the future.
Hi, I have a quick question. It's a little off topic from like the co-ops, but just in terms of like saturation, because I've kind of heard about that a lot, how like the pharmacy field is getting a bit saturated. How do you guys like, is that something that you think about, or is that something that you're seeing? So if you can let me know.
I don't think it's something that I think about as much. I mean, there's definitely a large interest in the pharmacy career path, and like we have a relatively large class. But I think that if you are passionate about what you're learning about on co-op, then it's not really something that, I mean, personally, it's not something that I am concerned with because I really enjoy learning what I'm learning about. I don't know if anybody else has any thoughts on that.
Just based off of what you said, Melissa, I think Melissa kind of hit the nail on the head. If you're passionate about this career, I think picking a school like Northeastern, at least for my personal experience, I think Northeastern has set me and my classmates up to be successful in the career, in part due to co-op, in part due to just the resources and things that we've gotten in our experience here. While pharmacy may or may not be saturated, it's not something that is necessarily something that I would concern ourselves with, because I think the education that we receive and the experience that we get prepares us to be good competitive candidates for what we want to pursue. And I know, Northeastern has, their graduates have like a very, very high, like 99% NAPLEX pass rate, and other graduates go on to get residencies and fellowships and postgraduate training. So while you can kind of look at the broad scope of pharmacy, I can't really speak to that, but I can just speak to Northeastern and their program. And I think that a lot of the other ambassadors would agree that Northeastern sets us up well in order to pursue what we want to do. And they've proven relatively successful in at least even recent years still, having their students go on to find jobs where they're happy and things like that. So
thank you so much.
You guys can also ask anything, not just about co-op, but like about classes or anything about our school life.
or Boston life and other fun things.
Hi.
How is the school life?
About the co-op. So specifically in the hospital co-op, are you in a specific department, or do you get to rotate to different departments and sections of the hospital during the 4 months?
I think that kind of depends on the position you take. It's really specific to the hospital, I would say. So for me, mine was, completely in central, but I know others are in other places. Some people had specifically an emergency department. So I think it's really dependent on the position you take and the hospital you're working at. But the pharmacists, I will say, are always open to you asking for experiences, because you are there to learn as much as you're technically an employee and working. They're always open to you asking to shadow or, you know, go somewhere else for a day. I was able to go to the OR for a day, not as like a pharmacy student, but just because I was curious and wanted to see it. So there's opportunity if you ask for it.
Someone mentioned getting certified for, I think it was IV, and either, I'm not sure exactly what related to IV, but are certifications common for co-ops, or I didn't see anything as like strictly part of the didactic education, but yeah, do you know a lot of people that get certifications throughout their education?
I did do a co-op where I did a chemotherapy compounding. I don't know if that's the one you're referring to, but I didn't have to get certified. I think I liked it though, because I actually realized that a lot of pharmacists like don't actually know how to compound, and I think it's like a really good background knowledge to have, because they're always they're doing like the final check. So I think definitely just bring it like for the future. It's just nice to be able to have that knowledge. And then we also will learn it in our skills labs. But it won't be like chemotherapy. It'll just be like typical, like we'll do it with like normal saline and stuff like that. But I can't speak to anything about certifications. I don't know if anyone knows anything about that.
I'm not sure if what you're hinting at may be like immunization certification. That is something that the school does recommend that we get for our appies. You can actually do it earlier. I actually completed mine in 2018, but I had just never given an immunization, even though I worked at a community pharmacy. I just didn't feel like it. So I didn't give them until I was on my Epi rotation. So I think that's relatively common, but you do have that opportunity to pursue, your immunization training earlier if you'd like, or there is a class in the curriculum that goes through it's a research methods where you do, you get like a city certification, and that's for use. You end up using that when you do your capstone, and that's like a certification for doing research and conducting research. But I wouldn't say that those are like through co-ops necessarily.
Thanks.
I don't know if you were referring to like getting certified to IV train, how Bridgette did at her institutional experience, but I know at BMC the co-ops that are IV trained, they train them on the job and in the IV room, and you're considered certified after you pass. You have to pass like a finger swipe test and multiple different steps in order to kind of like get everything checked off your list, and then you're able to compound in that IV room. My only caution to you regarding that is some institutions, if you are the IV room co-op student, you are in the IV room for the entire 4 months. And so if you are interested in doing both, that's just definitely something to ask at your interviews if they offer the opportunity to do both the central pharmacy and the IV room.
And then another fun thing about getting immunization certified is the Bouvé Health Fair every year. This year was a little bit different because staff weren't welcome, so I didn't get my flu shot this year at it, but annually it's open to all students, staff, and faculty. So there's huge queues wrapped around our big student center and the pharmacy, nurse, and I think just nursing, right? Are the PA students there as well? No, okay.
PA students are there, I think.
Yeah.
They are there, okay. It's like a Bouvé-wide, our College of Health Sciences, which encompasses all the different units, get together, and the students are able to vaccinate the campus for their flu shots, and it's a really great event to work together and be able to use those skills, and good results. I didn't get the flu last year.
For those of you who are in your 4th year and on your Epi rotations, do you think that the intensity and the length of the co-op helped prepare you for those?
You can go, Melissa. I can go after you.
Okay. I think absolutely yes. When you're on your co-op, you are an employee, and so you're being held accountable to be on time, be professional, which is exactly what's expected of you when you are on your final year rotations. And so your rotations, you're working 40 hours a week. Essentially, you're just there as a student rather than as an employee, which you are on your co-op. But I think it definitely prepares students for essentially the working world, which is what the Epi year reflects very well.
To chime in, at a couple sites I know, at least for the anticoagulation clinic, I was a co-op student with some other students, but we also had Epi students rotate through. So that was one of the things I liked about that site, was because I worked as a co-op, but I saw what the Epi students were doing. So it almost gave me a little bit of a preview into the Epi experience and the Epi year, even though I wasn't quite there yet. And then the other point I wanted to make based off of your question, I totally just forgot what it was. So I'm going to let someone else go and see if it comes back to me.
I honestly feel like it's the opposite for me, just because when you're a co-op student, you go to work and then when you clock out, you're kind of done. But when you're an Epi student, it almost feels 24/7 a little bit. And I think there's a little bit of a higher standard, just because at that point you would have taken all of your therapeutics classes and things like that, so they expect you to know like how to treat patients. Well, not completely, but with the guidance, of course. Like, you're actively trying to help treat patients, and you're actually like for example, I'm on my ID rotation right now, and I'm putting in like IVents, like interventions for like vancomycin, and you have to actually like put that clinical knowledge to practice. Whereas in co-ops, it's kind of an introduction to that. So I would say it kind of differs on those fronts, but you can kind of get glimpses of that through co-op, I would say. But I would say that they're kind of two different experiences for me.
I think when you think of co-op experience, it's definitely what you make of it. So if you really want to get like a pre-Epi experience, you can ask your preceptor, hey, I find this really interesting. Can I look this up? Can I do more? Can I? And they will always be, not always, but oftentimes most preceptors will be very responsive if you show motivation in a certain area, or you want to learn you want to learn more about something. That'll give you a more in-depth experience. There are, like Adessa said, definitely some co-ops where you go in, you clock out, and you can get by and do your job, and that's it. But there's always that opportunity, if you are interested in an aspect, to talk to your preceptor or take on some extra work, or listen in on when your preceptor is talking to the Epi student, and try to just get those extra experiences. And that will benefit you immensely if that's something that you're interested in.
These are great questions. Thanks, guys. I have two questions in the chat here that I just want to answer real quickly. One was the class size. So for most of the current ambassadors that are on the Zoom call right now, their class size would have been between maybe 130 and 145 total graduating class. No, somebody's shaking their head at me. Higher?
Oh, we're smaller than that.
You're smaller than that, right?
Our class was one of the smaller ones.
One of the smaller ones. As we're going on in the years, so if you're interested in our program now and will be applying for the fall 2021 or even fall 2022, we are looking to change our class size. So the class sizes coming in will be much smaller. They'll be around 100 students. That's between 100 and 120, but it's going to be more like 100. So while that may be, I wanted to answer that question just because it's going to be different for people entering in as opposed to people who are in there now. And another question was about graduate student housing. Right now, the university is not offering graduate student housing. graduate student housing on campus at Northeastern is predominantly marketed towards early assurance students who come through the PharmD pathway as freshmen, maybe live on campus for multiple years, and then when they go to complete their final year, they are technically graduate students. So there is that market available for that pathway. There was a limited number of spaces for direct entry students, but with COVID, they have chopped out graduate students. And the reason for that is because the majority of graduate housing at Northeastern is when they have remaining beds on campus, when they don't fill them with the freshmen and sophomore who are required to live on campus, they offer those beds sometimes to students who are coming in through a graduate program. So I know many different universities have different structures, and a lot of universities, even in the Boston area, offer true graduate housing, which means you can bring your partners and you can bring your pets. At Northeastern, we don't offer that type of housing, even in a pre-COVID world. And so one of the questions that I'll throw back out to the current students here was, do you live off campus, which I know the majority of you do, and do you commute? So would anyone like to give a brief background answer to that? That would be great.
I can start off. I lived on campus my entire time of pharmacy school, so I moved up here from New York. Kind of did some own research on by myself, so there's a couple of resources you could use. Facebook is actually a great one. There's Northeastern University Off-Campus Housing, I think it's called. In addition, there's also a website provided by Northeastern where you can look for roommates as well as apartments, so that was both very helpful. So I lived in Mission Hill, or on Mission Hill, I guess, which is like 15-20 minute walk off of campus, right in between the Green Line and the Orange Line, so very convenient for commuting. The Green and the Orange Line are the subway transit, by the way. But I actually decided to walk to campus just because I like the walk, so that's what I did. But commuting-wise, it's really easy. Boston's a very easy city to get around, and as much as it is a city, it's still kind of small in its own way, so I wouldn't be too overwhelmed by that. And I do know some people commute from farther, so I don't know if anyone here has a farther commute and wants to speak to that.
Well, I prior to COVID, I was living on campus, but right now I'm living in Salem, Massachusetts. So I know some people use the Commuter Rail, which is another transportation system that people use, and then I would take the Green Line or Orange Line onto campus. So if it takes about like 30 minutes, well, maybe like 45 minutes to an hour to commute back and forth. So yeah, that's an option too. And plus, if you live farther away from Boston, it's cheaper. The housing's cheaper. I found so.
I also live on Mission Hill, similar to Bridgette, but one of our classmates commutes in from Quincy every day, which is about 40. So it's a small suburban area south of the city, but you can access it from the Red Line, which comes into the city. So if you were to use the Red Line branch of the subway system, I think it's about a 45-minute trip into the city, into Northeastern.
I also live off campus, but I live kind of right off Tremont Street. So I'm a 5-minute walk to campus. And one thing I would want to add is, since obviously Northeastern has a big undergraduate university as well, there is a ton of housing in the area. So if you did want to live off campus, but you were worried about having to have a commute, there are, aside from just the Hill, there's a lot of neighborhoods that do surround Northeastern. There's Back Bay, Fenway, Kenmore, South End, Roxbury, and Mission Hill. So there is a lot of areas that you can live, that you can even be, a 5-minute walk to campus.
That's great, thank you. And as part of our admissions process, we actually have for admitted students who have deposited at Northeastern a hour-long housing webinar, very similar to this, where students come and give their experiences with finding housing in more detail. And we did that last year, and we just recorded our first one for in a post, well, not in a post-COVID world, in a COVID world, and we will be recording another one again sometime in March or April. So hopefully that will be helpful for applicants as they're going along. Someone asked in the chat, are the majority of students in the PharmD class at Northeastern early assurance or direct entry? This is a great question, and it has changed significantly over time. So I can't remember how many DEs there are in Bridgette's class, but I think Bridgette's class was the first class that I was a part of admitting. To give a better example, the class that just came in had about 40 direct entry students, and I believe, Bridgette, yours was around 28. Does that sound right?
Yeah, I want to say like 30 around there. So I think
Yeah.
Yeah.
So it's going to go up, up and up over the next probably 5 years. This isn't just true at Northeastern. This is going to be a countrywide for any PharmD program that has both direct entry and some kind of 0 to 6 or 2-4. They're all called different things. But you're going to see a leveling off where the majority of those classes that are going to be pretty 50-50 because we are seeing lower numbers of early assurance students coming in through that pathway. I think this is a great thing because it gives a much better mix of graduate students and undergraduate students in each class. We did have a number of years ago, only 4 people matriculate into the direct entry program as opposed to 100 and something early assurance. And those days are gone. That's not going to be something that's going to be in the future of pharmacy unless you're looking more than 5 years out. That is how classes are being created for PharmD programs. So great question. Any other last minute questions as we wrap up here? These have been wonderful questions. I'm really excited to put some faces to some names here now that I can see everybody in the chat. So happy to see some people I've already chatted with on the phone. And it's great to see others as well, new names. Any final questions as we wrap up?
Yeah, so I have a quick question. So do we have this opportunity to pass our co-ops in startups or big companies just to become more familiar with the business side of this field?
So there are co-ops that you can do in industry. One of my friends did one of them. So there are a good amount of pharma companies over in Cambridge, actually. So Northeastern does have an established co-op relationship with companies like Alnylam, which is over in Cambridge and Kendall Square, and there's a few other ones as well that you do have the ability to apply to. And you know, they are familiar with the co-op program, so it isn't even something that you would have to set up on your own. These are also an elective experience. Actually, I should have said that first. So that, never mind, I'm backtracking. So that would not be available to a direct entry student since you have to fulfill the 2 requirements of community and hospital for your 2 co-ops. Sorry.
But you guys can do it for your rotations. There's a lot of industry opportunities in your rotations. Yeah.
Also, to add,
sorry, say that one more time. Sorry, Bridgette.
No, you're good. You can finish up. I didn't.
No. That was kind of, I just wanted to add that. And like Northeastern has a really strong like fellowship. Like we have so many resources for fellowship. Yeah.
I will add to that. Even though you can, as a direct entry student, do an industry co-op, our co-op advisors often send out opportunities for employment. And more recently, I've been seeing like quite a few emails looking for pharmacy interns, which is what you would be once you apply for your intern license, for opportunities for per diem employment in the industry. So even though you can't do a co-op, you might see these emails come around looking for students to help out with per diem work. So there's always that opportunity.
And through your institutional and community co-ops, your mentors and even all the pharmacists that you're working with will know pharmacists that are working in industry. And so if you express to them that your industry is something that you're interested in, then I'm sure that they would be more than happy to put you in touch with someone that could talk to you about that.
Great question. Do we have one time for one more question, and then we will wrap it up. Any other burning questions here? Okay, well, I think we will leave it there. Thank you so much for joining us. Thank you to our ambassadors who are always wonderful to come and share their experiences. As I said, please feel free to reach out to me. The best part of my job is being able to chat with applicants, get to know applicants, give advice about the admissions process, and tell you more about the program. So I look forward to seeing your applications soon, and I hope everybody has a good rest of the evening. Thank you.
Thank you so much.
Thanks for
Take
seeing us,
care.
guys.
Bye-bye.
Bye.